Sigmund Freud's psychoanalyst. Ladies and gentlemen, I owe this honor to the association of my name to psychoanalysts, and subsequently, I shall share the historical development of the same. Granted that it is a merit to have created psychoanalysts, it is not my merit. It was first discovered by Dr. Joseph Breuer from Vienna, who first applied it from 1880 to 1882 in a case of a girl with hysteria. In the simplest term possible, I define psychoanalysis as psychology of the unconscious mind. It emphasizes on the role that the unconscious mind plays, especially in mental illness. Psychoanalysis is not only the intellectual achievement, but also one that has brought radical transformation in the efforts of human self-understanding. It is an extension to knowledge provided by renowned intellectuals such as Charles Darwin. Psychoanalysis has brought to light the fact that human psychology is driven by irrational, unconscious motivation. As part of medicine, psychoanalysis is the tool of inquiry and intervention in matters concerning mental life. Overall, my far-fetched research enabled me to understand the id, the ego, and superego, with the terms representing the conscious and the preconscious and the unconscious. The conscious mind represents the things that exist within our awareness. The preconscious is made of things that we do not know, but they can easily brought to awareness. The unconscious consists of thoughts and feelings that have been actively repressed. I address repression as a prototype of the unconscious because psychoanalysis is founded on helping individuals with repressed traumatic memories. The process brings repressed memories into the conscious to allow expression and complete healing. The unconscious is rich in content, but it but this material is forbidden to and experienced painfully, there, thereby hidden from the conscious. The act of repression reduces anxiety and guilt. For example, let us assume that a beautiful girl named Jo was raped at the age of 2. Of course, the experience was traumatic and with trails of permanent internal wounds. Repress of these memories protects joy from pain, bitterness, self self resentment, suicidal thoughts, and all other forms of internal conflict. Unfortunately, self-protection does not keep people like Joe from experiencing emotional emotional charged behavior. Therefore, therefore they require a way of expressing themselves so that they can be completely free. Expression of repressed thoughts can manifest in ways such as hypnosis, humor, slips, slips of the tongue, and dreams. It was first drawn to a deeper understanding of psychology by the inability of the neurological community to come into grips with the problem of hysteria. As hysteria patients continue to suffer in a big way and there seem to be no apparent neurological basis, I happened to learn about hypnosis from a fellow physician and friend, Dr. Joseph Brewer. He was able to successfully treat hysteria symptoms of Anna through the use of hypnosis. Subsequent application of the method provide a clear understanding of the ethology of hysteria and the role of the treatment process. We were able to determine that hysterical symptoms are, are symbols of the unconscious knowledge in the mind of a patient. They substitute mental acts that that are discharged in an abnormal way. Hypnosis allows normal discharge of strangulated mental processes, thereby leading to the removal of the symptoms through physical manifestation. As I further my research to ascertain the effectiveness of hypnosis, I realized that some of the patients could not respond to hypnosis induction. Furthermore, there were a few cases of symptoms reemergence which pushed me to discover a technique known as free association. This method allows intervention while patients are conscious. During the treatment process, I encourage my patient to speak out spontaneous thoughts as images, memories, and emotions flowed freely in their minds. This allowed me to observe the stream of consciousness positively so that I could take time to understand the problem of my patient. Spoken material from free association provided hints for the patient's unconsciousness. I would say this step of my discovery was the true turnaround of my experiment from hypnosis to psychoanalysis. Its application led to another psychoanalytic insight. Since I was not since I was not used free association of myself, I decided to pursue further examination of mental health through dream analysis. I did determine the deep conscious connection between hysteria symptoms and dreams content. There is a possibility that they both represent repressed thoughts. Dreams provide vulnerable information about the unconscious mind, especially when they are well interpreted. Through self analysis, I was able to figure out the concept I refer to as Oedipus complex. It traces back significant traumatic experience to early childhood. I later extended my research to paramex. These are minor errors that people make in everyday life and they have the motive since all behaviors of is unconsciously motivated. Paraphrase are just a small part of my everyday life psychopathologically studies. There are several other issues involved. All of the theories and issues addressed in my studies support one another to advance the concept of the unconscious and the application of psychoanalytic knowledge in the field of medicine.